Hi, and welcome to News Up Now. October is Breast Cancer Awareness Month, and we have Dr. Sam Brondfield, an oncologist at UCSF, here today to talk to us about breast cancer awareness. Welcome to the show, Dr. Brondfield.
Thanks for having me, Tammy.
So tell me, why is breast cancer awareness so important?
Breast cancer awareness is important because breast cancer is one of the most common cancers out there. In someone's lifetime, it's about a 13% risk of developing breast cancer. That's about 1 in 8 over the course of someone's life. So one of the most common ones out there, and when caught early, breast cancer is highly treatable, highly curable.
And what are the signs of breast cancer for people who don't know?
Breast cancer usually shows up in its earliest stage where it's confined to the breast. So actually most often nowadays it's found totally asymptomatic on a screening mammogram. But if it is found by some kind of sign or symptom, it's usually a lump in the breast that somebody finds either on their own or in a doctor's office. And there can be some sensation or pain or something associated with the breast lump, but typically it's painless and just a hard, immobile lump in the breast. More advanced breast cancer, sometimes people notice a lymph node in their armpit on the same side, but those are the usual signs.
So self-exam every month, especially for women, is very important.
What is definitely recommended is breast awareness, just being aware of what normal feels like for you. What do your breasts feel like normally when there's nothing wrong or no lumps in there? But over time, if you do manage to find a lump in your breast, for sure you would report that to your healthcare provider to discuss it. So just awareness of the breast and the whole body in general is recommended, just to know what's normal and what's not for you.
Right, and if you're feeling off and then something's not right, then always get it checked out.
Exactly, yeah.
And you'd mentioned earlier about mammograms. At what age should women start getting mammograms?
Yeah, there's a little bit of controversy there too. What is very clear and what everyone agrees on is that age 50 and above, for sure, mammograms are recommended. The controversial years are age 40 to age 49. It's really an individualized choice about whether to get mammograms starting at age 40. Some professional organizations split the difference and say start at age 45. So for sure 50, before 50, it's really a personal choice and conversation between somebody and their healthcare provider.
And if you are if you have a history of breast cancer or any kind of cancer, would early mammograms be recommended?
If you have a history of having had breast cancer yourself or someone in your family, especially a first-degree relative, a parent, a sibling, a child has had breast cancer, then absolutely have an early conversation with your doctor about whether you need to start those mammograms or other screening earlier on.
And let's move on to what are the risk factors for breast cancer, for developing breast cancer, because a lot of people don't know. They think maybe if you change your diet, you kind of decrease your chances.
Yeah, the biggest risk factor is age. As somebody ages, their risk of breast cancer goes up. Other important risk factors are, again, having had breast cancer before or breast cancer in the family, especially in first-degree relatives. Other important risk factors, alcohol consumption. Smoking is possibly one as well. In terms of diet and nutritional thoughts around risk for breast cancer, there's not a clear link there, but if anything, eating a lower fat diet may be helpful to prevent breast cancer. Those are most of the main risk factors. One really important one is that there are some inherited genetic mutations that put people at higher risk for breast cancer. The most common one is called BRCA, and if someone's a carrier of BRCA, of a BRCA mutation, then they're certainly at higher risk for breast cancer.
And can you elaborate on BRCA for people who don't know what that is?
Yeah, so BRCA is a gene that everybody has. When it's not mutated, it doesn't increase the risk of breast cancer, but when it's mutated, then it can increase the risk quite a bit. You may hear BRCA1, BRCA2, there's a couple different genes under that BRCA category. And people who carry a BRCA mutation are at risk for breast cancer, ovarian cancer, and some other types of cancers as well. So especially for people who have cancers that run in the family, super important to have a conversation with your healthcare provider early on to know whether you should get genetic testing to see if you might be a carrier.
Okay, and say you were diagnosed with breast cancer, what are your treatment options?
It depends on how advanced the breast cancer is at the time. One of the coolest changes in breast cancer and cancer in general is that now we're able to really figure out what type of breast cancer someone has on a molecular level. So there's a lot of work that has to be done to figure out how advanced is it, what are the molecular features. Those really determine what treatments are appropriate for a given individual who has breast cancer. But in broad strokes, if you have early stage breast cancer, it's really just confined to the breast, then surgery may be recommended, radiation may be recommended, and for some people, chemotherapy may be recommended as well. When the breast cancer is more advanced, then there are other types of newer therapies like targeted therapies, immunotherapy, some really cool innovations in oncology that have made a lot of inroads in breast cancer treatment.
Can we kind of talk about what some of those new technologies are?
Yeah, definitely. So I think in terms of newer stuff for breast cancer, one thing I'll highlight again is this genetic and molecular testing that's now being done to really categorize breast cancers into smaller and smaller subtypes. And that categorization can really help oncologists and patients know what therapies are most appropriate for them. So this kind of personalization of therapies for breast and for other cancers. And then some of the therapies I just recommended that are on the newer side, one category is called targeted therapies. Those therapies are sort of like heat-seeking missiles. They kind of go in the body and really home right to the breast cancer cells and targets on the surface of those cells and can seek and destroy those breast cancer cells. And then immunotherapy is the other one I mentioned. That's a really interesting and now pretty common therapy for a variety of cancers that takes advantage of the body's own immune system to rev it up and have the immune system seek and destroy the breast cancer. So those are some of the newer things.
Wow, it has changed a lot and progressed a lot.
Definitely come a long way.
Definitely, and definitely survivable, because I know people when they get diagnosed, they think, oh my gosh, it's a death sentence, but it's not.
No, the fact is the vast majority of people with early stage breast cancer, when it's caught early, are curable. And even in the advanced stages now, there's been quite a lot of progress in helping people live longer and fuller lives, even while living with breast cancer.
And how about reoccurrences?
Reoccurrences do happen. Again, the vast majority of people with early stage breast cancer don't have a recurrence and don't have to worry about it again. But for sure, recurrences do happen. Most of the time when they happen within the first few years after treatment for breast cancer. But it is important to be aware that sometimes recurrences can happen late in certain subtypes of breast cancer, 5, 10, even 15 years or more after treatment. So just to be aware of that.
Okay. Here's something that not a lot of people talk about, but men can get breast cancer as well.
Yes, absolutely. And it's most common in women, and to be inclusive of trans and non-binary people, anyone with breasts. But men absolutely can get breast cancer. It's much less common, but it does happen. There's no particular screening in general that's recommended for men to prevent breast cancer. But again, that sort of chest and body awareness, just to know what's normal for an individual, just to know when something's changed, is important.
Okay. Yeah, because I don't think our audience knows that too, because it's not something that's talked about. Can you kind of tell me about if someone has cancer, how does that factor in with the current COVID situation? Can they get the vaccine?
Yes. People with breast cancer and even people on chemotherapy are generally recommended to get the COVID vaccine. People who have cancer may actually have a worse time with COVID, so we want to do everything we can to prevent really anyone, but especially people with cancer, from getting COVID. People on chemotherapy, their immune systems may be suppressed and they may have a really rough time with COVID. Definitely recommended to get the vaccine, and in fact, people on chemotherapy for cancer were among the first to be recommended to get the booster shot for COVID. So all of that to say, really important to protect people whose immune systems may not be functioning fully because of cancer or the treatments that they're on because of it.
Exactly. Thank you so much. That was so informative.
Thank you, Tammy, for having me.
You're welcome. And thank you for watching. If you have any feedback, tips, or comments, please send them to tips@newsupnow.org. Bye, and see you soon.